Hi there. Very nice to meet you. How are you? Okay. Well, I'm so glad you were able to make an appointment and that we had availability for today. Definitely. Okay. Can I please verify your date of birth and your full name? Okay. So go ahead and tell me a little bit about what's going on, what's bothering you. I see. Do you mind if I write this down? Okay. And where is the pain located? Okay. And when did it start? Okay. Can you please describe the pain a little bit? Is it sharp, dull? Okay. Is it constant? Only when you swallow? Okay, so from what I understand here, you're complaining of some throat pain. Okay. But you're not having any flu-like symptoms. Okay. And when did this start again? Okay. Sorry. Yes, I did write this down here. Okay. And let's see. Have you had any dental procedures done? You did? And when was that? Okay. So about a year ago, you had a dental procedure done, and in September, about a month after that, you started to have this pain in your jaw. Okay. And can you please show me exactly where on your jaw? Okay. Are you hearing any clicking sounds when you clench your jaw? Do you know if you grind your teeth at night? Okay. Okay, so you did see an ENT doctor for this problem. And what did he say? I see. Okay, so he believes it's neurological or from the dental procedure. Okay, and I see here you had an x-ray and also a CT. Love it. And they're all negative for anything abnormal, any growths. Okay. Also, you had an endoscopy. Yeah. This is a very interesting case, but from what you're describing to me, it does sound like TMJ. Okay, temporomandibular joint dysfunction, which would definitely explain your symptoms and your pain. What I'm guessing is that when they did a dental procedure, maybe they may have damaged or touched a nerve. That happens not very many times, but it definitely happens. And I don't want to say for sure, but this is what my guess is. Let's go ahead and begin. I'm going to do a very detailed cranial nerve exam, and one of the nerves that I'll be focusing on are the ones that are innervating your jaw. Okay, let's go ahead and see if your vital signs are within normal limits, and then we'll go from there. Okay, I will take your temperature first. This will be sublingual, so we'll go underneath the tongue. I will put this underneath your tongue. Please give me a big ah. Good. Just hold it in. Okay. Okay, great. 98.3 is normal. I'm going to check your heart rate and your oxygenation with a pulse oximeter, and this will go on your finger, on your index. Is that okay? Okay. Perfect. So just relax for me, please. Take a deep breath in. Okay. Wonderful. Your oxygenation is 98 percentile on room air, which is perfectly normal, and your heart rate is 61. All right, let's go ahead and take your blood pressure. Do you have an arm preference? Okay. I'll put this on your arm. Okay. Perfect. Can you please uncross your legs for me? Okay, great. Okay. Okay, your blood pressure is also within normal limits, 120/75. And let's go ahead and listen to your heart and your lungs. Okay. I'll put this on your chest. Is it okay if I put it underneath your shirt? Okay, good. Wonderful. Okay. Okay. Can you please take a deep breath in for me? And exhale. Good. And on the other side, take a deep breath in for me. And exhale. Perfect. Okay. I'm going to listen to the signs. Take a deep breath in for me. And exhale. Good. And on the other side, take a deep breath in. And exhale. Okay. I'm going to check with a bell for any murmurs. Can you please take a deep breath in? Lean forward. And hold it in for 1, 2, 3. And exhale. Good. So I couldn't hear anything abnormal. Let's go ahead and write this down before I forget. Vital signs within normal limits. Heart rate was 61. Oxygenation 98. S1 and S2 were heard. No S3, no S4. Also no murmurs. And clear bilateral sounds on your lungs. Great. Okay, I'm going to start by examining your vision first. So I want to make sure that I'm ruling out anything else abnormal, and then probably I will end up checking your mouth and your jaw and your neck at the end, just so I can be sure that there's nothing else abnormal going on with you. And we are just going to focus at the end on your jaw. Okay? Okay. The first test that I will do is to check your pupil dilation. I'm going to need you to look at my nose. Good. Go ahead and look at my nose. Great. And same thing on the other side. Keep on looking at my nose. Good. And now can you please look up? Good. And look up again. Good. And now can you please look down? I'm just going to lift your eyelid up. Good. And go ahead and continue to look down for me. Perfect. Okay. I'm going to check your ocular nerve. And for this, I'm going to shine a bright light in your eyes, but I will be very close to you. I need you to look at the wall behind me. Okay? So keep on looking at the wall behind me while I come and examine your eye.
Okay, great. I'm not noticing anything abnormal here. Ocular nerve is intact and no splinter, hemorrhage, or anything like that.
Okay, so go ahead and continue looking behind me at the wall.
Okay, looks good. I'm not noticing anything abnormal. The nerves are intact.
Okay. Can you please follow the light with your eyes only? Don't move your head. Good. Good. Okay. Wonderful. Okay, let's go ahead and cover one eye. We'll both do the same thing. Can you please tell me when you see my fingers in your field of vision? Now, good. Same thing. Now, good. Same thing. Now, good. Let's go ahead and switch eyes. Tell me when you see my fingers in your field of vision. Now, good. Now. Now. Wonderful. Okay, for this, I will need you to keep your head still and focus on my fingers right here. Perfect. And now focus on my fingers right here. Excellent. And can you please tell me which fingers are moving, right or left? Good. 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 Perfect. Good. 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 Excellent. Good. Good. Okay. Now I'm going to draw some shapes with the light. Please tell me what shape I'm drawing. Perfect. Circle. Let's go ahead and try one more. Perfect. Triangle. Okay. Go ahead. Cover one eye for me, please. Perfect. Let's go ahead and do that. Excellent. And can you please tell me when you see my fingers in your field of vision? Good. And what color is this? Red. Okay, let's go ahead and switch eyes. Wonderful. Go ahead and tell me when you see my fingers in your field of vision. Now, and what color is this? Red. Perfect. Is this the same type of red that you saw with your other eye? Okay, great. Okay. Now what I'm going to do is I'm going to approach the pen light very close to your nose. Okay, this will be very slowly. I'm gonna need you to focus on the pen light. Okay, good. Keep on focusing on the pen light. Okay, good. Wonderful. Okay, now I'm gonna need you to focus on the red ball and don't let yourself get distracted by the green ball. Okay, so go ahead and follow the red ball with your eyes only. Don't move your head. And don't let yourself distracted by the green ball. Good. Perfect. Okay, for this, I'm gonna have you cover one eye, okay? And with your other hand, please hold the Snellen chart. Excellent. Okay, this looks good, right? All right. And can you please tell me what letter this is? Okay, now go ahead and read the whole row, starting with the first letter from here. Good. And can you please tell me what color this is? Okay. And what color is this? Perfect. Okay, let's go ahead and switch eyes. Wonderful. Can you please tell me what letter this is? Great. Can you please read this last row, starting with the last letter? Wonderful. I'm going to check the reflexes around your eyes. For that, I'm going to have you close your eyes. Great. And I'm going to slowly tap with a neurological hammer around your eyes to see the reactions. Okay. Good. 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 Okay, I'm going to check it for a color deficiency. It's very important and it's part of the vision program. Okay, so let's go ahead and start with a simple one. Can you please tell me what number this is? Perfect. And what number is this? Excellent. Now let's go ahead and continue. Can you please tell me what number you see right here? Wonderful. And what number do you see here? Perfect. Okay, can you please take me from this point all the way to this point? Okay, go ahead with your finger. Perfect. Okay, I believe you passed your eye exam. I did not notice anything abnormal. Let's go ahead and check your hearing next and your ears. Since you're not complaining of any ear problems, this should be very easy. Let's go ahead and first examine your ears from the outside. I will use that the pen light to do that. Can you please turn your head that way? Okay. And now can you please look the other way? Okay, I was not able to notice any abnormalities. Is it okay if I palpate the cartilaginous part of your ear, the outside? Okay, go ahead and relax for me, please. Okay, so I'm not feeling any lumps, I'm not feeling any abnormalities. Okay. Is it okay if I take a look inside your ear? Go ahead and look that way for me, please. Okay. I do see earwax, which is normal, but I'm not noticing any fissured tympanic membrane. Everything looks very normal. Okay. Can you please look the other way now? Great. Okay. Same thing on that side. Tympanic membrane is pearl gray. Normal vibrations. Margins are well defined. And I'm not seeing any excess earwax. No redness. Perfect. Okay, let's go ahead and check your hearing now. I will be using the tuning fork. And what I will do is I will create a vibration sound, okay? And I will put it right here on your mastoid bone, which is behind your ear. And I need you to tell me when you don't feel or hear the vibration. Good? Okay. So this is one. Tell me when it stops. Stopped? Okay. Let's go ahead and do the same thing on the other side. Tell me when it stops. It stopped. Excellent. Now I will be doing another exam, another test, and I need you to tell me which sound here is louder, position number 1 or position number 2. Okay. Oops. This is position number 1, and this is position number 2. Number 2. Great. Same thing on the other side. This is position number 1, and this is position number 2. Number 2. Perfect. Let's go ahead and switch tuning fork. So I'm going to use a different sound now with different frequency. Okay. Tell me which position here is louder, position number 1 or position number 2. This one. Perfect. Same thing on the other side. This is position number 1 and this is position number 2. Number 2. Okay. All right, now go ahead and close your eyes and tell me with which ear you hear this sound. Wonderful. What about now? Excellent. And what about now? Both ears. Perfect. Okay. Keep your eyes closed and tell me when you don't hear this sound anymore. Okay, good. Same thing. Tell me when you don't hear this sound anymore. Perfect. Okay. Now go ahead and cover one ear. Great. And I will whisper some words in your other ear. Please repeat them back to me. 1955. Great. June 1st, 1999. Perfect. Okay, let's go ahead and try it one more time, okay? So keep your ears closed and repeat after me, okay? Repeat the words. I want my tingles back from you. Okay, wonderful. Madpasmr. Excellent. Okay. Let's go ahead and keep your eyes closed and tell me how many times you hear this sound, okay? I'll be focusing on only one ear at a time. 3. Okay. I'm going to switch ears now. Tell me how many times you hear the sound. 4. Okay. All right. Now I'll be putting it in front of you. Tell me how many times you hear the sound. 3. Excellent. Okay. Let's go ahead and check your nose next, and I'll also check your smell to make sure that everything is intact over there. Okay, so first this nose test, I'm gonna need you to just relax your face. I will touch your nose and I will also move it side to side to make sure that there is no nerve innervation, there is no pain or sensitivity. Okay, great. So go ahead and relax for me. Okay. I'm going to just squeeze your nose. Squeeze, 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 squeeze. Okay. And I'm going to move it side to side. Good. Good. And now I'm going to cover one nostril. Okay. Can you please breathe in, breathe out? Excellent. And I will cover your other nostril now. Can you please breathe in, breathe out? Excellent. Okay. I will be checking the lining of your nasal mucosa. I'm gonna have to make sure that there is no obstruction either. Can you please look up for me? Okay, and now I will be using the otoscope again to check the other side.
Same thing on this side. Looks like everything is healthy.
Great. Okay, let's go ahead and check your smell now. Can you please close your eyes and take a deep breath in? And can you please describe the smell? Okay. And can you identify what I have in this jar? Okay. Wonderful. Yes, indeed, it is coffee. Okay. Let's go ahead and try one more. Okay. Can you please describe the smell first? Good. Good. Okay, now can you identify what this smells like? Yes. Let's go ahead and try again. First, I'm gonna need you to not to identify, but to explain. Good. Just try to visualize what you're smelling and go ahead and describe it when you're ready. Good. Perfect. That sounds about right. And now can you please identify what this smells like? Perfect. Okay. Let's go ahead and check your facial sensation next, and after that I will be checking your mouth and your throat. Okay, this should be fairly easy to examine your facial sensation. For this, I'm going to ask you to close your eyes and tell me if you feel it on your face. Okay, go ahead, keep your eyes closed and tell me if you feel this. Good. What about now? Perfect. What about now? Excellent. And did you feel that equally on both sides? Okay. Go ahead and keep your eyes closed and tell me where you feel this. Okay. Good. Same thing. Tell me where you feel this. Good. Okay. And what about now? Good. What about now? Wonderful. Perfect. Same thing. Keep your eyes closed and to tell me where you feel this. Perfect. What about now? Excellent. And what about now? Perfect. And what about now? Okay. And what about now? Perfect. And now? And here? Okay, very good. And now I'll take your sensation to cold. And I'll be using an ice globe to touch you on your face. and I need you to tell me if it feels hot or cold. Okay? Good. What about now? Perfect. And now? Good. Okay. So it definitely felt cold everywhere. Now I'm gonna need you to tell me where you feel me touching on your face. Good. Good. Perfect. Okay. Let's keep on going. Good. 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 Excellent. Perfect. Okay, I was not able to notice any abnormalities. Everything feels very good. Let's go ahead and check your mouth and your throat next. Okay, don't worry, this will not hurt at all. All I'm gonna do is just check your gag reflex and make sure that there's nothing swollen inside your throat and your mouth. Okay, I will also be looking for the color. So go ahead and give me a big ah. Ah, good. So it looks to me like I'm not noticing anything swollen. The uvula is midline and okay. Very normal color. I'm not seeing anything abnormal. Everything looks very healthy. Okay. Let's go ahead and do some movements with your tongue. Make sure that, everything is symmetric. Can you please stick your tongue out for me? Good. And now push it up and down. Good. Side and side. Excellent. Can you please push with your tongue inside your cheek? And the other cheek. Perfect. Can you please smile for me? Perfect. Now frown. Excellent. Puff your cheeks and keep them puffed. Excellent. Okay. Okay, so I'm going to put one drop on your tongue. First, I'm going to need you to describe the taste and then tell me if you can identify the taste. Okay. Okay, definitely. That was a very good description, and yes, you're right, it is lavender. Okay, let's go ahead and try one more. I'm going to put one drop. Okay, so first please describe it, and then try to identify the taste. Wonderful. Yes, I believe it is cocoa. Let's go ahead and try one more. Okay, I'll put one drop on your tongue. Okay, so please first describe the taste, and then try to identify it. Okay. Yes. I would say it is sweet and it is bananas. Perfect. Okay. I will be checking your neck next, so go ahead and tell me if you feel any kind of pain. Okay. Can you please look up? I am not feeling anything abnormal. There are no lumps and no signs of any swollen lymph nodes. Also, of course, you just did the CT, so that also didn't show anything, enlarged, which is great. But I still wanted to make sure that I'm doing my assessment properly. Now, I did notice the gap that you have in your upper right side of your jaw. Yeah, but that did not look, worrisome. And in fact, it looked very good. It looked like everything healed properly. Yeah. Okay, so I think I could recommend a night guard. Because what I'm feeling is what's called a temporomandibular joint dysfunction. Yeah, and I could not feel any clicking. Go ahead and can you please clench your jaw for me? Clench, clench, clench. Good. And now open your jaw. Wide, 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 wide. See? Nothing. I could not hear any clicking. Let's go ahead and do that one more time. Close your jaw. Good. And now open, 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 open. Nope. Close your jaw. Good. And now open, 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 open. Yeah, so there are no abnormalities there. But I do believe it's TMD. So what we do for that is we give the mouth some rest. If it hurts on the right side, I'm gonna need you to maybe not chew on the right side and use only the left side. Also, what you could do is to put a hot towel every 20 minutes and keep it on for, 10 minutes. Yeah, until it gets cooler. Just be sure that the towel is not too hot because it can damage the skin. Just it feels comfortable. And the way to do that, you could maybe put it in the microwave if you have one. It takes about 20 to 30 seconds for a medium towel like this big to warm up. And then the night guard, you can find one at any pharmacy store. But also I do recommend that you go back to your dentist and get a proper one that will fit to your mouth properly. It will also be very hard, so you will not grind your teeth even during the day, because I have a feeling that you do that during the day mostly and not at night. Yeah. Are you feeling stressed lately? Did something happen in September when the pain started? Okay, I see. So that might have triggered it, because stress and anxiety can definitely trigger TMJ disorders, and when that happens, you get a lot of inflammation on one side or both sides, but for you it's just one side, and that inflammation can actually compress the nerves in that, that pain. You get that pain from the compressed nerves. Now, I highly recommend that you go back to your dentist and you check that tooth again. Yeah, well, absolutely. I will prescribe some medication that will help with the pain nerve, but long term, that is not a solution. This is just temporary. Long term, you have to make sure that you relax your jaw and you don't chew, hard stuff on your right side. That will help a little bit more. Okay, well, thank you so much for coming in today. I hope you will feel better soon, and if you have any questions, don't hesitate to make another appointment. If the pain doesn't subside in about 2 weeks, again, I'm going to ask you to come back so that you can be seen again. Okay, thank you so much for allowing me to do this exam on you. Have a good day.